Good evening, ladies and gentlemen. It's my honor and pleasure to talk to you today on the subject of understanding heart attack. As you will know, we have lost a lot of our community members through this condition, and therefore it is important to understand the subject. I am no heart specialist, but I was a specialist in vascular diseases, and as you will see, the heart attack is related to vascular disease. Heart attack will be discussed under various topics: anatomy, pathogenesis, symptoms, diagnosis, treatment, and prevention. Don't worry if you don't understand any of these things, but we will cover the subject as best as possible. So the first thing to understand is the vascular anatomy of the human body. So you have the heart here in the chest, and all the red structures are arteries and the blue structures are the veins. Basically, arteries take away blood from the heart to the rest of the body and are pulsatile, whereas veins bring back the blood from the body or muscles and organs back to the heart, and they're usually non-pulsatile. So for example, when you feel a pulse at the wrist, that is, you're feeling an artery, whereas what you see in the back of your hands is the bulging structures are veins. Vascular disease occurs when you have deposition of fatty material in the arteries, otherwise known as atheroma. And as the material builds up in the arteries, you get restriction of blood flow to the rest of the body. If it occurs in the leg arteries, one can get calf pain from that condition. It's otherwise known as peripheral arterial disease. If the deposition occurs in the arteries to the kidneys, one may get high blood pressure from it and eventually kidney failure. If the disease occurs in the arteries supplying the head and neck, one may get stroke. And the subject of today is the heart arteries. So the heart muscle itself is supplied by artery, and a heart attack occurs as a result of the disease of those arteries. So here's a diagrammatic example of a blood vessel, and in a normal artery the blood flow is not hindered because there is no disease, so you get full blood flow. However, as you get deposition of the fatty material, otherwise known as plaque, you get narrowing in the artery, which then restricts the blood flow. So in the peripheral arteries, you can have a narrowing occurring in the artery supplying the leg, for example, and because of the reduced blood flow, the pain occurs in the calf, usually through walking or strenuous walking or going upstairs or going uphill. So the moment you put the muscles of the leg through strain, they complain in the form of calf pain, and this is otherwise known as intermittent claudication. Now this was my specialty, and you can see the dye, which is represented by white here, which is dye in the blood vessel here supplying the leg, and you can clearly see that there is a discontinuity in the vessel between this level to this level, and following a successful balloon angioplasty, this was the result. So there was full flow of blood down to the leg, and you can see that at 2 months how the vessel looks almost normal. Another quick example of the same is this artery in the right leg, which is blocked, and following a successful opening, or what we call recanalization, and you can see that at 2.5 years there is still good blood flow maintained to that leg. So what about in the heart? In the heart, the problem is called coronary artery disease or coronary heart disease, and the condition results from various factors. So people who are diabetic would have the possibility of developing heart disease, or if you have high cholesterol where there is a family history, that results into deposition of fatty material. High blood pressure, high fatty diet and obesity also contribute to the causes of heart disease. Lack of regular exercise is another one, and of course smoking does not help with this condition. So what are the symptoms of a heart attack? Well, it is typically described as central chest pain, and it is characteristically described by patients as very heavy pressure on the chest, heaviness, tightness, or crushing sort of chest pain. The pain can move up to the jaw, or to the neck, or to the back, or to the arms, and usually it's the left arm, and sometimes the discomfort can be in the upper tummy. So in summary, characteristically, if you get central chest pain going down to the left arm, that is very likely due to a heart attack. Remember, it is central chest pain, so even though one's heart is on the left side of the chest, the pain is typically central. Together with the pain, one may get sweating or break into a cold sweat. You may feel weak, lightheaded, faintness or dizziness. You can have shortness of breath, cough or wheeze. These symptoms are due to the fact that the heart is not pumping as well as it should be. And of course there may be nausea, vomiting, and of course a level of anxiety. How is this diagnosed? Usually medical history of chest pain, etc., as I described, can point to the condition. Cholesterol test also helps, but the important thing is an ECG or an electrocardiogram. This is where some wires are placed on the chest and the activity of the heart is determined. A blood test may follow, and certain enzymes in the blood can tell you whether you've had a heart attack or not. Subsequently, the patient may have coronary angiogram and possible stent. We will come back to this. So, looking at the arteries of the heart, they are called coronary arteries. So here's the heart, the heart muscle, which itself is supplied by arteries. So you have the right coronary artery, the left coronary artery, and the circumflex artery. So there are three main arteries to the heart. Angina is a condition where there is restriction of blood flow to the heart muscle, especially upon exertion. So you may have one artery of the heart, for example. If it's normal, there will be free flow and there won't be any symptoms. The moment a person develops these fatty deposits called atheroma, and you get restriction of blood flow, then upon exertion, so for example, walking fast or walking upstairs or walking uphill can give symptoms of chest pain. So that may be due to the restricted blood flow, and it is called angina. Now, you may have angina and the doctor may recommend that you undergo an angiogram and angioplasty. So usually there are two access points. There is the wrist and there is the groin. So the doctor may either use the wrist or the groin. It's their personal choice. They would put local anesthetic to that site, and a tube known as a catheter is introduced. And when the catheter reaches the right place into the heart vessel, blood vessel, a dye is injected through the catheter, and any narrowing or blockages will be demonstrated, and then the doctor may go on to carry out an angioplasty and place a stent. So if you have these fatty deposits, otherwise called plaque, that may result in poor blood flow, but the artery is still open, so you have a narrowed artery, and that can give symptoms of angina. And what subsequently happens is that this fatty deposit may rupture for some reason, and as a result of that rupture, one gets formation of blood clot, and therefore the artery becomes completely blocked and there is no blood flow to the rest of the heart beyond this level. And this is otherwise also called coronary thrombosis. So same thing again here, a narrowing with rupture of the plaque, which then eventually results into coronary thrombosis. Thrombus means clot, basically. So clot blocks the artery completely, and therefore there is no blood flow beyond that artery. So in this diagram here, you can see there is the normal coronary artery, and when you develop a narrowed area, that is called a stenosis, and this may result into angina or chest pain during exertion. Subsequently, when the narrowing becomes a blockage due to a clot, that results into a heart attack. And as a result of this heart attack, basically that part of the heart muscle which is supplied by this artery begins to die, so there is muscle damage. And if a small area of muscle is damaged, that would be a minor heart attack. If it's a large area of the muscle damage, that would be called a major heart attack. So if one suspects a heart attack, you have to call 999 and an ambulance immediately. That is very, very important. When the paramedical staff come, they will provide pain relief, they will give oxygen to the patient, they will check blood pressure and pulse for the patient, and most importantly, they would do an electrocardiogram or ECG, which is basically putting wires across the chest. That tells them the activity, electrical activity of the heart, and by looking at this, they will be able to tell whether it is a heart attack or not. At the same time, they will give the patient aspirin or some sort of blood thinners to stop clot from getting bigger. And this is why it's very important to call an ambulance immediately so that they can introduce appropriate medication and not allow the clot to get bigger, because clot getting bigger means you're heading towards a major heart attack as opposed to a minor one. and then the ambulance will take you to the hospital. When you go in the hospital, they would do the same thing, pain relief, provide aspirin or other blood thinners, oxygen, and most importantly, they would carry out a coronary angiogram and may introduce a stent or stents at the same time. If you are not suitable for having stents, and we'll discuss this later, they may consider doing bypass surgery, usually at a later date. So, angina, as we described, means a narrowing in the artery, but not a blockage. And I think we've covered this basically, which means they will introduce a catheter into the vessel in the heart. They would put a stent, which is normally mounted on a balloon, and when the balloon is expanded, the stent expands and stays in place, and then you're likely to go home possibly on the same day or the next day. That is for angina. So here's what a normal coronary angiogram looks like. So the catheter is coming here, and this is the right coronary artery, and you can see the dimensions of the vessel are fairly uniform, and it flows all the way unhindered, and this is the left coronary angiogram. So in summary again, coronary angioplasty and stenting involves looking at the narrowing or blockage of the artery, and basically one passes a fine guide wire through this narrowing and then subsequently place a balloon which has got a stent mounted on it, and when you expand the balloon, the stent will fall in place and then you can remove the balloon. So here's an example of an abnormal coronary angiogram. A narrowing is demonstrated here, and following a successful stent procedure, you can see how the vessel is nice and uniform. So here's to show you
coronary angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to clogs or blood clots. Most coronary angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent, which is a small tube made of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as it is inserted into position. Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.
So that was the actual procedure demonstrated graphically, and I'll just show you some examples of again a narrowing in the left coronary artery. Here's another narrowing, and following a successful stenting procedure. Similar example here, narrowed right coronary artery. This is after the successfully placed stent. Another narrowing in the right coronary artery. This is following a successful stenting procedure, and the same example. Now all these examples are narrowings, therefore the patient may have symptoms of angina rather than a heart attack. If you have a heart attack, the artery is completely blocked, but in effect the procedure is the same as for angina, and one is likely to go home in a day or two. Recovery takes a bit longer, and one would have to be off work for a few days. So here's an example of the right coronary artery, and you can see from beyond this level there is a blockage, but beyond there the artery does not look too bad, and this is following a successful recanalization and stenting. Similarly here, a narrowed bit here and then a blockage. You can see that the dye is not going beyond this level, and here you can just see a fine guide wire that's been manipulated through the blockage, and this is following a successful stenting procedure establishing blood flow. Very similar example, complete blockage to this level, and you can imagine if this blockage stays for any length of time, it would result in damage of the heart muscle. By establishing blood flow as soon as possible, you reduce the chances of further damage to the heart muscle. This is to actually show the procedure. You can see this is the right coronary artery, and at this level the dye is not going beyond there. The guide wire is manipulated, and then the guide wire has extended all the way into the artery. A balloon catheter is placed, and these two dots demonstrate where the balloon is. And when you inflate the balloon with stent on top of it, this is what establishes the continuity of the artery. So upon discharge from the hospital, the doctors may provide you with statins. These are medications to lower cholesterol. If you had high blood pressure, they will provide medication to keep your blood pressure within reason. They will provide you with blood thinners. Aspirin is a very good medication, but it does not agree with everybody necessarily, and in that case they may give you some alternative medicines. Now, if the heart has not been working as well as it should, it is possible that you may get fluid retention, and for that they will give you water tablets. We'll come back to this point. And also, subsequently, some patients may still end up having some narrowings in the artery, which may give them angina, and for that they are given either what's called a GTN patch or a GTN inhaler or a puffer that helps with the pain of angina. So when you get discharged from the hospital, you have to avoid for a week to 10 days any demanding activities, heavy lifting, etc., driving. Return to work has to be within a few days. You'll be stopped from flying for at least a few days, and you've got to stop your sexual activities for a while. So, heart attack versus heart failure. Some people confuse the two facts, and I will try and explain this. Heart failure can occur after a heart attack. When you talk about a failure in any part of the body, it usually means that it is not functioning 100%. So, for example, if somebody's kidney is only working 70 or 60%, they are suffering from kidney failure. In the same way, if your liver is not functioning as it should, it's called liver failure. Now, in the case of the heart, if it is failing to supply enough blood to the body, in other words, not functioning 100%, which is usually due to damage to the heart muscle there, so that can result into heart failure. If you've got a major heart attack with very substantial damage to the heart muscle in an acute setting, in other words, when you've just had a heart attack, that can result into death. However, if your heart is functioning but not quite 100%, then it is not able to shift the fluids to the rest of the body, and that can result into breathlessness or leg swelling, and that is called water retention, and this is where they would give what's called water tablets. What about coronary bypass? Coronary bypass is usually done to 3 vessels, so it's called triple coronary bypass. Triple meaning 3 major vessels: the right coronary artery, the left coronary artery, and the circumflex artery. So they may use veins from your leg, and these structures in blue are veins to attach the 2 vessels, and sometimes they use an artery which is already there in the chest to do the 3rd one. So that's a triple bypass. A bypass operation is usually done when there are multiple areas of narrowings or blockages and multiple vessels are involved. So in this case, stenting is not really indicated. It would mean having to put many stents, and the result would not be so durable long term. So one can have commonly a triple bypass, which is 3 vessels, quadruple 4 vessels, or quintuple 5 vessel bypass. How do you prevent having a heart attack? Well, obviously you have to have a healthy diet, which includes plenty of vegetables, fruits, etc. You have to avoid saturated fats, which means butter, ghee, and sunflower oil. You're recommended to eat unsaturated fats, which is oily fish, avocado, nuts, and rapeseed oil. I'm mentioning this because it's important. A lot of our people use sunflower oil that tends to be high in saturated fats, whereas rapeseed oil, which in fact in UK is just vegetable oil, is very good, and it is low in saturated fats and high in unsaturated fats, which is the good fats. You have to be physically active. You have to try and keep your weight healthy. You've got to give up smoking. Decrease blood pressure if you have high blood pressure, and if you have diabetes, it should be well controlled. And of course, they may suggest statins for high cholesterol and aspirin or similar to keep the blood thin. I've written here to say, do you have diabetes? And sometimes people don't know that they have diabetes. So if you've got a family history of diabetes, or you're obese, or for any reason you are suspecting that you may be diabetic, it's really very easy to tell your GP to measure your glucose levels and tell you whether you are diabetic or not. So it's worth having that checked. So what is the take-home message from today's talk? Do not ignore these signs. If you get a chest pain, which may be radiating to any of these places, but particularly the left arm, then it is very suspicious of a heart attack. And other symptoms may go along with it, like shortness of breath, lightheadedness, sweating, fainting, dizziness, nausea and vomiting. You have to call an ambulance immediately. And also you can take 300 milligrams of aspirin if it is not contraindicated for you. In other words, if you have taken aspirin in the past and if it doesn't agree with you, then you cannot take it. But generally speaking, most patients are okay with it, and it is worth doing that immediately, and this would prevent the clot in your coronary artery from getting bigger and doing further damage. So in conclusion, I would reiterate again that for a heart attack, do not ignore the symptoms. Act immediately, call an ambulance and take aspirin if not contraindicated. Time is of the essence. As we mentioned, that if you have a clot in your coronary artery and if it's treated quickly, you may prevent the heart muscle from getting further damage. However, if you delay, then it's possible that that clot may progress further within the artery and cause more damage to the heart muscle. Thank you very much.